joining us for the next episode of our social media podcast mini-series. This is a series that's presented by the SMA's Physicians in Training Leadership Committee. And today we're continuing with part 2 of our interview with Sarah Garner. She's the director of the Pathologist Assistant Program at Tulane University School of Medicine and an adjunct professor at the Tulane University School of Science and Engineering. Sarah also has an established presence on social media on both Instagram and Twitter, and her Instagram account, Passion for Pathology, has garnered over 60,000 followers. So thank you so much, Sarah, for joining us again. In the last episode, you told us a little bit about how you got started with social media and some of your personal experiences. And this episode, we really like to pick your brain about any advice you have for other medical trainees who may be interested in getting started with social media or are already involved. So the first question we have is, you're quite involved with the admissions process for the pathologist assistant program at your institution. How do you think social media can benefit medical students and pathology assistant students when they're applying for future programs?
So I think that there's a couple different ways that this can be beneficial. Kind of twofold. So it can be beneficial for the applicant to learn about the program that they're applying to, whether it's a PA program or a residency program. If that program or people in that program have a social media presence, they can learn about the actual program and see if it's a good fit for them. Because any program is going to have a website where it tells you, the curriculum and the requirements and all of that. But to actually get a feel for something, you really want to be able to interact with the faculty and residents and current students and things like that. So if a program does have a social media presence, I think that can be really beneficial for the medical students or the applicants, whoever it may be that's thinking about applying. And then kind of on the flip side, it can be beneficial for us on the admissions committees to see the student or applicant on social media. So for example, if I'm interviewing somebody for a residency spot, for example, I may have already interacted with them on social media. So let's say they are applying to pathology residency program and they follow me on Instagram, and I then, can connect with them and I can actually see their content as well. I've had that happen with a couple of people where they actually have already had conversations with me, and then I can see their interests and things like that. So even before you get to actually talk during the interview, you already kind of at least have an introduction to that person. And then during the interview, especially this year, the way that we had to do a lot of interviews because of COVID, a lot of them were on Zoom. And so you just don't get that same personal interaction. I mean, I know that you still get to see the person, but it's not the same. And so it can kind of help with that. And then also, since most interviews are a little bit shorter, you do have limited time to interact with that person. So if you've already interacted with them before the interview, that's helpful. And it also gives you a way to connect with that person again after the interview. So for the applicant, it can really help them stand out if they do have a positive social media presence, at least in my opinion. That's definitely something I always look for when we're going to interview somebody.
So with that, out of curiosity, is there like a standard process that programs usually have for reviewing applicants' social media or anything like that?
I think that's going to depend on the institution and the program. So for me personally, that's just something that I will look at, or if I just recognize a name from something, but I don't do it for every single applicant. So at least for us, we don't have a specific protocol to do that, because I know some institutions will be actively trying to look for things that are either good or bad. And for me, I never want to go just find somebody's, personal social media just to try to find something negative. So it's not that, it's more so if they have a professional social media page, or if it's a medical student, if they have a medical student type page. So I don't ever look at somebody's personal Facebook or Instagram or whatever like that. So it's kind of a fine line, but I know that some other institutions do have an actual protocol for kind of weeding out people using social media. So with that, you do want to be careful with what you are posting on social media, whether it's a personal or a professional page, because you never know if a program is going to be looking at it either on purpose or accidentally, or if somebody may forward it to them, something like that. So just be careful, I guess.
Totally. Are there anything, any issues that trainees should look out for in particular, things that really stand out for social media that they should avoid?
This is hard because different people are okay with different things, and so you're never gonna be able to please everybody. So it's hard to make just kind of a blanket rule. So the way that I think of it and the way that I tell my students to think of it is if you were a patient or if your loved one was a patient and you saw your health professional acting in this way on social media, how would that make you feel? And if it's uncomfortable or angry or upset or any of those things, then it's probably not something that you should be posting, especially on a professional page. And then another thing, just kind of a general thing to keep in mind is this useful that I'm posting? So that's more so if it's a
Mhm.
professional page. So if you're just posting like, I don't know, daily updates about whatever you're eating, like no offense, but nobody cares. um,
Yeah.
it's you want it to be something that's actually meaningful,
Mm.
especially if you're posting clinical things. You never want to post something just for shock value. So this applies to medical students. If you do have permission to share cases, you don't want to just be posting it to be like, hey, look, a cool case. You want to be posting it in a way that's respectful and in a way that's educational. Otherwise, there's not really a point in posting it, and that can be borderline disrespectful to the patient or the institution. So I guess it seems like it would be common sense, but it's not a lot of the time. So just try to put yourself in the other person's shoes, whether it's the patient or the patient's family or something along those lines. And I find that that is typically pretty helpful.
Yeah, that's a great reminder, especially because I think, um, there are certain cases or certain patients that when you're kind of learning about it in school, it could be really interesting and exciting to you at the moment. You just want to share it with people that you know, even if it's coming from, um, if you mean to benefit other people, but oftentimes it's easy to forget that, this is an actual patient and you're you might be kind of crossing some boundaries on releasing that information. Can you talk a little bit more about, what you have to consider regarding HIPAA when you're posting on social media? And are there any gray areas that you think, could be more beneficial if it's better defined?
Absolutely. So with HIPAA, when we first, have our HIPAA training, it seems like it's all going to be very straightforward, but a lot of it really is gray. So it kind of depends on your institution. If you work at a huge institution where you have so many patients and so many cases that might be similar, it may not be something that you have to be as careful about as opposed to if you work at a smaller institution, like let's use, I guess, pathology as an example because that's what I do. If I'm going to post about a cool, let's say like somebody had a colectomy case, well, what if there's only one colectomy on the schedule that day? And what if you posted and
Mhm.
say, today I had this colectomy case? So, one thing that can be really identifying is just using the date. So, you never want to say things like today, yesterday, last week, or this afternoon. And so, with that in particular, things like Instagram stories, that can be kind of tricky because even if you're just, let's say you're a medical student, you're like, oh, in clinic today, I saw this. Well, you never know how many people were there that day, or maybe it's one of your followers. And if you describe it in a certain way, they may be able to know that you're talking about them or their loved one. Or, 10 years later, somebody could recognize that you were talking about them, things like that. And so it's not always going to be things that are obvious. Like, obviously, you're never going to post somebody's like medical record number on social media. That's like a big, obvious thing that nobody would think to put in there, right? But some things like even age or rare diagnoses. So sometimes if I get a really, really interesting rare case that's worthy of an actual case report, I may want to get up and scream it from the rooftops and tell everybody about it. But if it's super rare, then if you're saying, this is a 49-year-old female that had this really rare diagnosis, well, there's not other people that have that. And so, especially if people are like, oh, well, you work at Tulane, so that's got to be so and so, it can be really identifying. So, it's hard because sometimes you're just excited and you don't think about it, or sometimes the way that you describe something doesn't seem like it'll break HIPAA and then it does. So with that, especially with pictures, you never want to have any skin typically. So that can be really hard. I know in derm, people sometimes really struggle with being able to share clinical information because it's on the external surface. And so it's a lot easier to identify something like that than, let's say, an internal organ. So that's something to keep in mind. Even like backgrounds of pictures sometimes can be identifying. So, what are some other things? I guess age and time are probably the most pertinent for everybody. So try to just stay away from like today in clinic or today on the surgery schedule, things like that.
And with that, I'm curious about, do you see any issues or challenges with interacting with people on Instagram?
I personally, from a clinical standpoint, I haven't really run into many issues with that because in pathology, we're a little bit more behind the scenes. And so I do interact with patients directly sometimes, but not that often. And so that's not typically the problem I run into, but I have had colleagues who have said, I have a public Instagram page where I talk about work, and then my patients follow me, and it can kind of just blur those lines where they'll message them, they'll send them a direct message about asking about like their medication or what they should be doing or their stretches or things like that. And then it's like, well, I can't really treat you through Instagram. And so it does definitely blur those lines. And then also kind of, are we friends, or am I your doctor? Like what's that line there? But with that, I do think that it can be actually more beneficial because I feel like, I don't know, medicine is all kind of just this smoke and mirrors where people think, oh, you're in medicine, it's like a totally different thing, but we're all still people too. And so I personally think that interacting with patients in a more personal manner through social media can actually be a good thing, as long as you're careful with those boundaries. But something that I have run into personally is with students, it does definitely blur that line because they're like, oh, well, I saw you posted this on social media last night, but you didn't respond to my email. It's like, well, those are two different things. Or like if a student messages you about, I don't know, a question about homework or content or something, and then it does just get kind of weird. And so that is a line that is blurry. But again, like for me, the benefits totally outweigh any negatives that I see with it, because it allows me to connect with students and patients on a more personal, kind of down to earth level. And it's always okay to say, I can't answer that on here, or ask me in class, or ask me in an email, or I'll see you at your next clinic visit, things like that, as long as you're comfortable doing things like that. Now I would stay very vigilant about providing actual clinical advice on social media. So I can't tell you how many messages I get where people will send me their pathology report and say, here's my report, or here's my diagnosis, like, what do I do? And so my response to that is, I don't provide medical advice or information. This is purely educational. Talk to your physician. And so you got to be really careful with that, because on the one hand, let's say you're a medical student trying to like promote information about whatever specialty you're interested. If someone takes that as actual medical advice, it could harm them. And so that's always something to keep in mind, is how you're answering things and how you're wording them.
What are some suggestions of what has helped you kind of find this balance between sharing your personal life and sharing, keeping a professional image? Do you, I think most people find that a little bit challenging, and especially now that social media has evolved in such a way where it's kind of encompassing every aspect of your life, and it's okay to share a lot of different facets of your life. So kind of keeping your personal life and your professional life definitely gets blurred. So what has helped you with that?
I would say that my number one advice would be, if you're going to have more of a professional social media preference or presence, make sure you have separate personal and professional. So myself, other people I know that are really involved on social media, they say the same thing. I have, let's say, my personal Instagram and my professional Instagram. And that way, if you want to post things that are more like you wouldn't want anyone and everyone to see, you can save that for your personal one. Or let's say you have kids and you don't want to be posting pictures of your kids on your professional page because you don't want everyone to be able to see that. That's something that you can keep separate. But with that being said, I do think it's important to have some sort of personal flair on your own social media. So, I mean, that's kind of one of the reasons I switched from having an anonymous account to actually like having my name and face associated with it, because it makes it a lot more personal. Um, and so the way that I think about it is, if I was a random person that didn't know anything about me, would I care about this? So like, as personal as I get on there is, I'll give, my personal opinions on teaching and about work. So always like somehow tied into professional world. I'd say as far as I stray away is probably like posting pictures of my dog. And I did that one time on my Instagram story, I think it was. And it was just because like my dog came with me to work. And so I like took a picture of him, I think with my skeleton back there, and posted it. And I got so many messages being like, oh my gosh, can you share more about your dog? And I was like, absolutely, like be careful what you ask for, because I will share all about my dog. So I guess it's like you want to have a personality, but you also don't, it's not about you. Like if it's a
Yeah.
professional page, it's not about you or your personal life. So it's kind of hard to balance that. So I guess it would be more so like, is this something that you would ever refer to in like a job interview? And if not, then it probably shouldn't be on your personal page or on your professional page. So like, for example, if I went to interview for a job, I wouldn't probably talk about some of the things that I post on my personal Instagram, as opposed to like maybe my dog or like a live music event that I went to recently. So I guess that's kind of where I would draw my line, if that makes sense.
Are there any other hurdles that healthcare professionals should look out for when they're starting out on social media and trying to get involved for build their professional accounts?
I would say maybe there's always people that are going to get on and disagree with you, or I don't know, try to correct you or say that the way that you're presenting information isn't the best and things like that. And I would say just ignore that, because there's literally no way to please everybody ever. There's no way. And so I think I mentioned this in the previous episode of just don't let perfection get in the way of trying to do something. So if you post something and you think it's really great, and then two people comment on it saying they didn't like it, well, just think of all the other people that did like it. So it's really easy to get hung up on the couple of bad things, as opposed to all of the people that did like it or it did help. And so just try to avoid that. There's always going to be people on the internet that are going to kind of hide behind their screens and say hateful things, and just ignore it as best you can, I guess.
Yeah, for sure. Ignore the haters.
Yep.
Are there any resources that you would recommend for, that people who are starting out on social media will use that you found helpful?
There is a really good website. I think it's called the Pathology Resident Wiki page, and it has a whole page that's called, I believe it's called Social Media, excuse me, Social Media for Pathologists. And when I'm saying that, you're probably like, oh, I'm not in pathology, but trust me, it gives such good tips on like things you need to look out for HIPAA, things, how to post things, why to post things, things like that. So I think that's a really good resource. But also, I think just kind of browsing through other healthcare professionals and or student pages to get ideas, kind of see what they're talking about, see what they're posting. And if you are inspired to start social media, it's probably because you follow people that you like. And so maybe go back to those and use those as resources. Always feel like you can ask people for help. So let's say there's a page that you follow and you really like the way that they do things, you can always ask them. I mean, worst thing that's going to happen is they don't respond to you,
Right.
And then I guess try out different things, try out different apps and things. But my advice would be, number one, make sure you understand HIPAA, and that pathology resident wiki page can be really helpful for that. And then actually, I just recently did a webinar with Corey Nash, who is also a pathologist assistant, and we got on and we talked about social media. And I'm just remembering this now. We made an entire document with a whole bunch of resources, so I can give you the link for that
Oh
if you
my
want to
gosh.
post it.
Yeah, that's awesome. We could include that link in the description of this video. So yeah, that I will check both of those resources out. It's cool because I think a lot of or at least a couple of people in pathology are kind of starting to get a presence on social media and post interesting cases.
Absolutely. So pathology is huge on social media. At Instagram, not as much.
Mm.
Um, but on Twitter, pathology is
Oh,
huge. Like they call it Path Twitter, and there's even like pathology tweet awards and things like that. There's just so many things that you can get involved in on social media, and so many different projects that people have been able to start because of
mm,
social media. Like there's a couple different things that I'm involved in where it's just a bunch of different people that were on social media and are in pathology and then just came together because of that and now can do a whole bunch of other things not even related to social media. It's, I mean, it's crazy. It's amazing. And I know other fields are getting more heavily involved in social media all across medicine, but yeah, pathology in general, I think it's become pretty huge. I do hope that more pathologist assistants will become involved in social media, and so that's one of the reasons why we actually train our students during their PA program of how to post on social media, why it can be useful, things like that. So we'll see. I don't know. I hope that it does continue to get bigger because it's pretty impressive and there's so many resources that you can use. It really is amazing.
are there particular directions that you feel like how healthcare professionals can contribute to social media? Are there different, needs currently?
I think there's a lot of different ways that you can go with it, which is kind of overwhelming at first when you think about it. So, if you are, let's say, a really experienced physician or someone who wants to share your knowledge to trainees, then you can kind of gear your content towards that, which is really, really important for medical education, health professions education, um, especially with interinstitutional and interprofessional collaboration and education. That's really important. But let's say you want to aim your content more towards, I don't know, high schoolers or undergraduate students who are still trying to figure out what they want to do. That's a totally different path. If you want to have more of like a personal journey through medical school or whatever school you're in, that's like a totally different way you can go
Mm,
with it. If you want to have a page where you're providing content that can educate the general population. So for example, if you want to, I don't know, talk about the COVID vaccine and different things about that, just kind of gearing more towards the general public, like that's a totally
mm,
other way that you can go. And so at least a problem that I've run into is I kind of I do like a little bit of all of that, and so that can be hard to have on one page because then let's say I have a couple like, I don't know, less detailed posts that are geared more towards like undergraduate students. Well, that's
mm,
not necessarily going to serve pathologists or pathologist assistants or medical students because maybe it's too basic for them. But at the same time, if I'm posting my super detailed stuff for, I don't know, other people, then those other people get kind of lost. So honestly, there's so many directions you can go in, and that makes it hard because then it's like, okay,
mhm.
do you post all of that on one account or do you create multiple accounts that the different people can follow? So there's just so many opportunities right now. I do think that one of the most important things for us as medical professionals should do is educate the general public because pretty much everybody's on social media now. And then also work on fostering mentorships and collaborations with students. So those would be like my two top picks
Mm.
because you can always find information on actual treatments and disease processes and things by looking at actual journals and using things like PubMed to search for things. You're not always going to immediately go to social media for that, even though it can be very helpful for that. So I guess if I had to pick, it would be general public and educating trainees.
So here's a question for some of the medical trainees who may be watching this, who are thinking about getting involved on social media. Is there anything that you felt like, as you were starting out on social media, had helped you connect more with your followers or helped you gain a following?
I think honestly, just as Instagram has evolved, well, and Twitter too, but I'm more so active on Instagram. But now that we have things like stories where you can post a poll, um, or um, things like that, where you can actually engage with the audience and say, what do you want? Or what did you find more helpful, this style or this style? And they can then literally tell you exactly what they want. And then also you can use the analytics and it'll tell you what types of posts that you're posting that people are engaging with more. which got the most likes and things like that. And so if you look at that and you compare your different types of posts and you're like, oh, this one people really found helpful, this one nobody really interacted with, and then that can help you kind of adjust and change your future content. But really, I think I haven't really tried to grow my following, which is why it's been kind of the same the last, I don't know, year, maybe 2 years. I think there are things that you can do like organization, promoting your page a little bit better, and hashtags are huge. You don't really realize how huge hashtags are. Excuse me. But if you hashtag something, people are going to be able to find it a lot easier. So, like, I personally have been really lacking in hashtags and organization and things like that. But those are definitely things that you can do to reach a wider audience. You can also reach out to other pages that are similar to yours and ask them to share your stuff or share theirs, and then maybe they'll share yours back, things like that. I know that there have been pages who have just started out who have reached out to me and said, hey, would you mind looking at our page, seeing if there's any content you like? And if there is something that you like, will you share it? And I'm like, absolutely. Or sometimes I'll just see something I really like and share it. And then they'll message me and say, wow, thanks for sharing that. Like, so many people are now following me. I'm like, cool. I mean, you had a great post, so I wanted to share it. So things like that, they seem like little things, but they can really go a long way in actually sharing and increasing your audience. And then also to kind of go back to that personal touch, I always think if you have a little bit of personality in your page, people are going to be more likely to engage with you as opposed to just kind of follow you or stop following you over time.
Totally, totally. Thank you so much. And it was such a pleasure talking to you.
Yes, thank you so much for having me. This was fun. I hope I had some helpful tips. And feel free to
Definitely.
reach out if anybody has any questions. Never hesitate to ask.
Definitely. And thank you all of our listeners for tuning in on the social media podcast mini series.